Tonight, a warning going out to nursing homes and rehab centers to check their records for this woman, Shannon Nicole Womack, who police say has been posing as a licensed practical nurse and a registered nurse, even a nurse supervisor.
Shannon Womack is not a licensed professional in the state of Pennsylvania or any state that BCI was able to investigate.
Pennsylvania State Police say Womack was hired as a nurse in Pennsylvania, Connecticut, New Jersey, Indiana, Tennessee, and Georgia.
Around 20 different aliases were attached to Nicole, along with 7 social security numbers.
Pennsylvania authorities started looking into Womack after a traffic stop in April where they say she presented a fake ID. Investigators say 9 employers in the state put Womack on do not retain status for professional misconduct before her arrest, including Southmont of Presbyterian Senior Care, where she allegedly diverted oxycodone pills intended for residents, according to a criminal complaint.
This is a vile act, or acts, I should say, not only taking advantage of older citizens in this Commonwealth, but them not receiving the care that they need, nor the medication that they need because of someone that puts themselves in this position to defraud them.
The Georgia Board of Nursing put Womack on its imposter alert list in October 2022. The state's attorney general also issued a cease and desist order, but could not locate her. Now prosecutors charging Womack with identity theft, forgery, endangering the welfare of care, and several other charges. Womack has not entered a plea. Police say the schemes date back to the early days of the COVID pandemic, when the need for nursing staff was critical.
It wasn't uncommon for these different residence locations, agencies to reach out to host agencies and say, we need some extra shifts filled. That started in 2020, and it was such an easy transition, she just kept going after it.
Aaron Gilchrist joins us tonight from Atlanta, Georgia. Aaron, are police concerned that woman may have committed more crimes than the ones you just listed there?
Yeah, Tom, I think so. We know that Womack made that first court appearance this week, and despite that, we heard from police in Pennsylvania over and over again that they are still in the middle of their investigation. They're still looking into the potential for more incidents here. We know that they've also told healthcare providers and health facilities across Pennsylvania to go back through their employment records to look for instances where they may have employed Womack under a different name. They've also published a list of aliases they say she used. They've asked these folks to go back through their employment records to see if they may have had her on the books at some point. And of course, this is now something that's coming to light in all of these other states where police in Pennsylvania say Womack may have worked in healthcare facilities. In Georgia, for example, we know, as we noted, that cease and desist order was something that came out after complaints were filed about Womack, again, potentially using different names, and the investigation was completed by the nursing board for the state of Georgia, where they said they needed to take some action to list her among the people who were imposters, they say. And so this is something, Tom, that I think these agencies are going to continue to look at to try to see if other people may have been impacted. You think about that one facility in Pennsylvania that we mentioned with the oxycodone that was missing. They said there were 120 pills missing, affecting several patients who were not getting their medication as a result of those pills having been taken, Tom.
All right, Aaron Gilchrist for a wild story. We thank you for that.